Many of the old people or the older generation accept this as part of aging. Initially may wake up like once in the night, now it become twice, then 3 times, then maybe reach a point it's almost every hour, every 30 minutes. Hi, I'm Dr. Chua Wei Jin, Department of Urology, National University Hospital. I have with me today Mr. Vijaya. He's one of my patients, and together we will share with you the topic on benign prostate hypertrophy, BPH in short. BPH is a benign enlargement of the prostate gland. It's a very common disease that actually affects men. In Singapore, the prevalence of BPH is about 40% for men 60 years and above, and the incidence increases with age. For men with enlarged prostate, I think the most common symptoms that they present with will be slowness in the urinary flow. They will also come to me for increase in the number of times they need to pass urine, especially in the night, and that affects their quality of life, affect their sleep.
Because cannot stand already because too frequent and my sleep is disrupted. That's the main reason.
It is very common for a patient to experience nocturia, which is basically the increase in number of times they need to pass urine in the night. This is something that a lot of people or a lot of elderly men take it as part of aging, and they don't really seek any medical help until it got worse, whereby they affect their quality of sleep, quality of life, or when they heard about this condition being discussed either in the newspaper or in some media, or maybe among friends like a coffee shop chat.
Traveling one place to another. For example, as he says, you're taking a bus journey. In between, you cannot control the urine, no, it comes out, no. So that is a very critical point. You know, my underwear all wet because of the urine. Cannot control. It comes out. So by the time you reach, it's too late already.
I think this is probably an issue with awareness of this condition, because many of the old people or the older generation accept this as part of aging, and to them going to the toilet a few more times in a day, a few more times a night is part of the aging process. Because one thing about BPH is that it's a slow growing process, because it doesn't happen overnight. So gradually, initially you start off with maybe you need to go to the toilet more frequently, you may have a bit more urgency to go to the toilet. Initially you may wake up like once in the night, now it become twice, then 3 times, then maybe reach a point whereby, that's what Mr. Vijaya was saying, that it's almost every hour, every 30 minutes. Yeah. So it's ongoing process. So and patient will kind of like realize over time that it's getting worse. I think what is important is that they should see the doctor early rather than late and suffer in silence. Because many times if they pick up the condition early, there are many ways we can consider treating this condition. We can start off simply with medication, and then if the condition worsen or patient cannot tolerate side effect of medication, then we can move on to other line of treatment, which includes surgery. Let's start with medication. I mean, medication is usually my first line of treatment for most patients. It's convenient. They just pop a pill, let's say one pill a day. What it does is that how I look at treatment is really look at the severity of the disease and how much it affects the patient. So when the patient sees me in the clinic, I'll evaluate the patient, I'll ask him about the symptoms, assess how severe the symptoms are, and also how much it impact on patient life. Then I'll do a quick physical examination for patient, whereby we will assess the size of the prostate gland and see whether it has affect the kidney function. Because if the prostate is very big, sometimes it may affect the function of the kidneys. Then I'll do a flow test for the patient to assess the urinary flow. From there, that will give me some idea of the severity of the disease. And from there, then we'll discuss with the patient the treatment option. And if I were to start on medication, there are 2 classes of medicine or 2 types of medicine that we can offer patient. The first one helps by relaxing the bladder neck, and that actually helps to improve the urinary flow. I think that's something that Mr. Vijaya actually tried. And there's another medication that can help to shrink the size of the prostate gland. And that is also another medication that also will help. But that medicine probably is slightly slower acting, and it takes a bit of time before you see the full effect. So usually I'll explain all this to the patient, and then I'll explain to them how the medicine works, what is the side effect of each medication, and from there, then we will let the patient try the medication. I usually give the patient a trial medication for about 2 months, and I'll assess them again. But if the patient couldn't tolerate the side effect, or if the medicine doesn't really work well for them, then of course we will move on to the next line of treatment, which will be surgery.
Actually, it's no problem. I took it during the trial period, but it's slow reaction. That's why I'm asking him for the surgery, which are the good method of surgery, what are the surgeries you have and all that. He explained to me all in detail. He showed me the 3 types of surgery also, which is more safer, which is high risk and all that.
There were actually 2 main group of surgery. The traditional surgery, which is TURP, and then the newer, less invasive, the minimally invasive option. So the total of 3 surgery that we discussed.
Correct.
And during that session, I actually show Mr. Vijaya the videos, and then we talked about the pros and cons of each of the procedure in details.
Yeah, I decided, yes. I told Dr. Chua, okay, I want this one because it's safer and then it's not much of a problem.
I think Mr. Vijaya actually took some time. He took about a week.
Yeah.
He went home, discussed with family members, and came back a week later. So he actually did seriously consider all the 3 options and then weigh the pros and cons before he decide which is the one that he'd like to go for in the end. Mr. Vijaya has gone through a water vapor treatment, which is one of the new minimally invasive treatment options we have for patients with enlarged prostate. Procedure that can be done in the day surgery setting. So Mr. Vijaya come in the morning, had the procedure done. We'll observe him in the day surgery ward for a couple of hours to make sure everything is okay. And then after he was actually discharged on the same day. The main thing about this procedure is that it actually injects steam into the prostate gland, and that causes some swelling of the prostate initially. So patients who are on this treatment needs to be on the urine catheter for 7 to 10 days. I think Mr. Vijaya was on this for about 10 days, the catheter. And throughout this period of time, I think the most inconvenient part is having the urine bag. So the first 3 days he had the urine bag. By the day 4, we changed to a valve, and that actually helped in terms of the moving around. Without the bag, it's actually easier to move around in the house, or you can just wander out.
I was in the day surgery. Dr. Chua did the surgery. Then after that, I was in the day ward for a few hours there. Then initially, after sometimes, the pain started. Then I called the staff nurse to call Dr. Chua to give me some medication to kill the pain. And then he prescribed some Panadol or what, and then give me that will be better. Then I just carry on. So I go off at about 8 plus. I mean, it's okay, suffering is suffering part, but after that it's all relaxed already. Very good, actually. Very smooth.
The main help is the reduce the number of times you need to wake up in the night, right?
Yes. That is very important.
Yeah. So now Mr. Vijaya can sleep better.
Yes.
And I think the daytime you also don't have to go so often in the.
Correct.
Yeah.
Correct. First thing on what you really facing the problem, and then I will ask you to see a doctor, because this is something nobody can say. Only the doctor can classify what is the problem. I will tell them the truth. Instead of wasting time, you better see a doctor and get it treated early. I will give them the confidence saying that, I go through, there's nothing to worry about, there's no fear, nothing, there's no pain, only a short period to suffer, that's all. After that, back to normal and very convenient.